So good morning, good afternoon, good evening everyone. I'm Trevor Hassel and I have great pleasure today in my capacity as President of the Healthy Caribbean Coalition to welcome everyone to the second in a series of Healthy Caribbean Coalition-led webinars on the development of alcohol policy in the Caribbean. Today's webinar is being conducted, as was the first webinar, in association with the Caribbean Institute of Alcoholism and Other Drug Problems, otherwise known as CARIPAPAN. And it has been made possible with the assistance and support of several partners, including the NCD Alliance and the Department of Health of the United Kingdom. Today we are especially pleased to have Dr. Rohan Maharaj, Senior Lecturer in Family Medicine at the University of the West Indies, St. Augustine, Trinidad and Tobago, a Fellow of the Caribbean College of Family Physicians, and Honorary Technical Advisor on our to the Healthy Caribbean Coalition. Dr. Maharaj will present on the topic titled Gaps in Current Regional Alcohol Policy and the Desire for Change, Opportunities for Caribbean Civil Society Organizations. I want to recognize the fact that Dr. Maharaj has played and continues to play a major role in the Caribbean in championing the need for appropriate alcohol policies in the region. I'd now like to invite Dr. Sandra Reed, Director of CARIPAPAN, to introduce Dr. Maharaj. Sandra?
Thank you, Sir Trevor. On behalf of CARIPAPAN, I would like to join Sir Trevor in welcoming all of you to this webinar. For those of you who are unfamiliar with CARIPAPAN, we have been representing 40 years of alcohol and drug abuse prevention in the Caribbean, and quite a few of you will be graduates of the CARIPAPAN program. CARIPAPAN remains at the forefront of alcohol and drug abuse prevention through education and policy, and has recently joined hands with the HCC to this end. And one of the joint initiatives, as you have heard, is the hosting of these webinars on the CARIPAPAN platform, aimed to sensitize and educate persons on the need for and the intricacies involved in establishing alcohol policy in the Caribbean. This morning, as we launch into our second CARIPAPAN webinar, I am pleased to introduce to you our featured presenter, Dr. Rohan Maharaj. Dr. Maharaj, as you heard before, but for those of you who may have joined a little later, is a senior lecturer in family medicine in the Faculty of Medical Sciences, University of the West Indies, St. Augustine campus. His main research interest has been mental health and chronic disease in the Caribbean primary care population. This work has led to over 40 journal articles, many of which were summarized in the 2009 book, Psychosocial Issues in West Indian Primary Health Care. Dr. Maharaj is currently active in clinical practice and is also the principal investigator at the Trinidad site on the Eastern Caribbean Health Outcomes Research Network, which is a 5-year cohort study in collaboration with Yale University. As an extension of his interest in mental health and chronic disease, Dr. Maharaj has been working since 2012 on alcohol issues in Trinidad and Tobago and with the Healthy Caribbean Coalition on alcohol policy in the English-speaking Caribbean. Dr. Maharaj is the HCC's technical advisor on alcohol policy. This morning, Dr. Maharaj will be delivering a presentation, Gaps in Current Regional Alcohol Policy and the Desire to Change, Opportunities for Civil Society Organizations. Following this presentation, we will have opportunity for questions and comments. But at this time, I welcome and introduce to you Dr. Rohan Maharaj.
Good morning, everyone. Thank you very much for those kind words, Sandra, Professor Hassel. I want to thank the Healthy Caribbean Coalition and CARIAD for putting on this series of webinars. Thank you for the audience for taking time off from your busy schedules to attend. This presentation that I'll be sharing with you today focuses on two bits of work that I've been engaged with over the last 2 years. I hope you will find it informative, interesting, and even maybe a guide to your future work. The first part of the presentation examines trends and policies and interventions within the English-speaking Caribbean. And the second part examines a research that we did, a bit of research that we did in Trinidad, looking at households and their willingness to support change in local alcohol policy. The idea is that we hope that this will provide us with some understandings of where our population is in terms of willingness and readiness to change around alcohol. For those of you who are unfamiliar with the Healthy Caribbean Coalition, I just put up a slide that represents the web page and a little bit on the definition of what the Healthy Caribbean Coalition is. And it's basically a civil society alliance established to combat chronic diseases and the associated risk factors and conditions. I welcome you to attend and the site. There's lots of interesting information and resources, and I think it would be useful for us all to be part of this coalition. My outline today would be looking at, one, the WHO Global Strategy, for those of you who are not aware. Two, looking at the research on regional policy coming out of the WHO 2014 document on country statistics. Then presenting the National Alcohol Household Survey from Trinidad and Tobago. And a bit on the way forward and discussions at the end. Before we go any further, I think we just to remind ourselves on what it is we're talking about here. We're looking primarily at the policies, and policies, there are lots of definitions. One definition is a policy is a course of action or principle adopted or proposed by a government or other organization that is advantageous or expedient. Now the important thing, and this is what I want us, why I think we're really here, is that while science and evidence may create the policies, it is really the emotion and the politics and the people behind it that really determine whether anything is done. And I think that more than anything else, why this talk is focused on the civil society organizations in the region, because I think that by looking at the policies in a very global sort of way, you can recognize the gaps and opportunities for the work and the opportunities especially where we can work to make a difference. WHO Global Strategy. First of all, let's let you know that WHO has been doing a lot of work on alcohol, and its global strategy identifies 4 priority areas for global action. First is public health, advocacy and partnership. Second, technical support and capacity building. Third, production and dissemination of knowledge. And fourth, resource mobilization. Its 10 key areas of policy options and interventions at the national level include leadership, awareness and commitment, health services response, community action, drink driving policies and countermeasures, availability of alcohol, marketing, pricing policies, reduction in the negative consequences of drinking and alcohol intoxication, reducing the public health impact of illicit alcohol and informally produced alcohol, and monitoring and surveillance. Those strategies, those key areas highlighted in red are known as the WHO Best Buys. A Best Buy is an intervention that is not only highly cost-effective, but also cheap, feasible, and culturally acceptable to implement. So the WHO has not only provided a list of what they will be doing in terms of the global strategy, but some of the key interventions that individual countries and organizations can look at in terms of where their money can be best spent, their efforts can be best placed. And it was with that sort of information in mind that I started to look at regional policy. And there have been several iterations of this document. This came out in 2014, and the previous one was from 2011. And these are available online at the Global Status Report on Alcohol and Health. This document is free of charge on the web. So when you start looking at the English-speaking Caribbean, the first thing to recognize is that all the countries in the Caribbean have some level of laws, policies, and interventions governing alcohol. Broadly speaking, I think that there are four distinct ways in which alcohol is represented in our regional policies. One, in legislation, which doesn't necessarily deal with health, but often with a social and economic focus. And many of these legislative pieces are sometimes over 100 years old, involved things like excise and taxes and so on. As a distinct national policy, where alcohol is recognized for its health implications, and there are only a few countries in the region, unfortunately, that has a distinct national policy, and we'll look at that more closely a little later in the presentation. Alcohol is also represented as part of the NCD and mental health policies in the region. And finally, in conjunction with policies addressing illegal substance use, such as often mixed with alcohol and cocaine drug use and so on. So policies are present, and one of the key elements that you recognize is that there are opportunities for civil society to work with our governance structures to enforce the laws and legislation that are already present. And I think this is one of the points I will make again at the end. So when you look at the WHO 2014 document, looking at national policies, monitoring taxes, and then looking at legislation around blood alcohol concentrations, what we have at the top here are 12 of the English-speaking Caribbean where I could get the information: Antigua, Barbuda, Bahamas, Barbados, Belize, and so on. TNTO is Trinidad and Tobago. And then what we look at are some of the policies that are represented in the WHO document. The first one is asking, do the countries have a written national policy which have been adopted and revised? And from the WHO site and from talking to a lot of the countries around the region, there is only Bahamas really has a formal written policy that's been adopted and passed and accepted by the national assemblies and so on. So this is something, and interestingly, Bahamas seems to have two, one from 1932 and another one, a revised edition from 2006. According to WHO site, all the countries in the English-speaking Caribbean except for Jamaica and St. Vincent and Grenadines have a national government support for community action. I suspect that that's just that it isn't formally written, but I would argue that if you speak to the Jamaicans or the St. Vincentians, that they will tell you that their government will support community action, but it may not be a formally recognized part of it. National monitoring system, and we see about half of the English-speaking Caribbean has no system in place, and it may well be that they rely on organizations such as CARIPAPAN to do some of that work. When it comes to excise taxes on beer, wine, and spirits, almost universally across the region, we can see that occurs, and many of these laws have been around for many years. National maximum legal blood alcohol concentration, and again, roughly 50% of the region has a law governing blood alcohol, and you see that the levels are generally set at 0.08% for blood alcohol concentrations. When you look at minimum age interactions, there are minimum ages for off-premises sales of alcohol beverages and for on-premises sales of alcohol beverages. For most of the region, it's between 16 and 18, even though from the report, it seems that Antigua Barbuda has this very strange level at 10, age of 10. I'm not quite sure where that's come from. So generally, again, at 18 years for the minimum age interactions with alcohol. Restrictions on and off-premises sales of alcohol beverages. And this is an interesting one in that it looks at availability of alcohol at retail outlets in terms of time, location, specific events, selling alcohol to intoxicated persons, and at petrol stations. And there's a mixed bag. Generally, only 2 of the states, Bahamas and St. Kitts Nevis, has restrictions across the board for all. Many of the islands have, for example, no restrictions on sale of alcohol at petrol stations. And in Trinidad, we actually have signs at the rum shop that says sales any day, anytime. And you can, people can basically open at their will. So there's no restrictions. When I was growing up, you couldn't sell alcohol on a Sunday or a Thursday afternoon in Trinidad. And roughly in the 1980s, that was changed. And now you can get alcohol at a rum shop almost any day and any time. This issue about density is something I want to come back to. And as you see, most of the islands have no policies on density. And it is one of the areas that the people internationally place some emphasis on, in terms of if you have a lot of outlets very close to each other, there's increased availability of alcohol and so on, and that seems to drive a lot of drinking behavior. And finally, from coming out of the WHO document on alcohol policy, is the issue about advertising, marketing, and labeling. When you look at legally binding regulations on alcohol advertising and product placement, again, Bahamas is one of the only places that has some restrictions. Jamaica, even though this happened very recently, I think within the last couple of years, and I haven't been able to get much detail on this, but in terms of legally binding regulations on alcohol sponsorship across the board in the region, almost all the islands have no restrictions. No restriction on health labeling on alcohol and advertisements, and again, no restrictions, very few restrictions on alcohol advertising. So I think this provides us with a sort of a cross-sectional view of what's happening in the region. I went a little further, playing some little games here on my computer, putting together to say what is our overall score in terms of alcohol policy in the region. And if from previous 4 or 5 slides, what we had, there were 21 items, of which there are about 5 that were WHO best buys. So there's a score for each of the islands of about 21, and a total score of about 252. And therefore, we're only batting around 47%. That is, all the possible policies that are recognized by the WHO as being important, we have just about 50% of these instituted regionally. Interestingly, when you look at it per island, the Bahamas stands out. Of the 21 policies, they have legislation around 19. So I think there's some lessons here to be learned, both from St. Kitts, who has the next best score at 14 out of 21, and the Bahamas. And I've in fact been in touch with some of the PAHO people at Bahamas, trying to find out, how is it that this has happened? One of the challenges we have in the region is whenever we bring up restrictions on advertisements and restrictions on alcohol, people think about the tourist trade. But Bahamas is a tourist island, has a very strong income from tourism, and yet still they have these very, have all of the policies, almost all of them, being enacted in the island. So there's some lessons to be learned here, and I think, okay, so just see here a little note about, can you all hear me a little better? Sorry about that. Aisha, could you just give me a little note if you're hearing me a little better? Okay, so I think the Bahamas provides us with an opportunity for some lessons to be learned in maybe studying their legislative processes. The next thing I want to share with you then is the National Alcohol Survey of Households in Trinidad and Tobago. And this is a study that we've been involved with, and Dr. Sandra Reed has been one of the collaborators with us on this survey. And the study basically has 2 parts. The first part was looking at the effect of alcohol on the psychological and social fabric of the household. And the second, which I'll be sharing with you today, are the household's willingness to support a national campaign to change alcohol regulations, advertisements, and other policies. A little bit on the study itself. It covered about 53 enumeration districts randomly selected from the enumeration districts in Trinidad. We had experienced enumerators from the Government Central Statistical Office. There was an interviewer-applied de novo instrument developed from over 18-month period with input from a sociologist, public health practitioners, epidemiologists, psychiatrists, family physicians, and statisticians, and it was pre-tested. We had a 92% response rate, and so that was 1,695 households in Trinidad, representing over 5,000 people. The domains that I'll be presenting today were, and again is relevant to a lot of what I've talked about in the region, was 1, density of outlets, 2, availability of alcohol, 3, advertising, 4, adolescent issues, 5, music, 6, labeling and retail sales, 7, drunk driving, 8, public education, and 9, taxation. So one of the things we asked the population is how many bars or rum shops are there within walking distance of your home? And 87.1% said that there was between 1 to more than 3, and 32% said more than 3 rum shops or bars within walking distance of your home. So that tells us a little bit about the outlet density, so that you have a pretty dense availability of outlets that sell alcohol and retail. And as I said, these outlets often have license for any day and any time. And we asked the households, do household members become annoyed by the number of bars in the neighborhood? And surprisingly, almost 90% said no. Would household members like to see fewer bars in the neighborhood? 85% said no. Are household members disturbed by noise from the bars? Over 90% no. And are household members disturbed by patrons of the bars? Over 90% saying no. So this was very interesting for us. Would you like to reduce the opening hours of bars and rum shops? And only 37.6, 62.4% said no, 37.6 saying yes. So first of all, I think when you look at it in terms of the international literature, even the literature says, look, reducing density and reducing availability makes a difference to availability of alcohol, especially to young people, and to spontaneous drinking. Then from this in our population, people are not really willing to change a lot of what's happening currently in the setting. And I think that's an important part of it. So it helps in terms of guiding us when we want to try to make changes through advertising campaigns and so on. We asked households, which of the following changes regarding alcohol do you believe members of this household will support in the national campaign? 1, banning all alcohol advertisements at cultural or sporting events. And over 65% said yes to this. So it's not unanimous. Not everyone agrees that banning all alcohol advertisements is recommended. They won't support this. Banning all alcohol advertisements on TV, radio, newspapers, and cinema, and it was even less here. This almost went down to about 50-55%. Restricting alcohol advertisements on TV, radio, and people are a little more comfortable with the restriction, but not with a complete ban. We're looking here at over 70%. But again, not unanimous in support of advertising ban. Which of the following changes regarding alcohol do you believe members of your household would support in a national campaign around adolescent issues? 1, advocating for proof of age to be shown before alcohol is sold, and people are very comfortable with that, almost 90%. And setting the legal age for drinking at 21 years, over 80%. So these are 2 possibilities that are not well discussed. I mean, besides the US, almost none of the region has looked at alcohol, raising the age from 18 to 21. So this is something that maybe we can look at in our region, and people are prepared, apparently seem to be able to be prepared to support this idea. Which of the following changes will you support around music? Banning of songs on radio with reference to alcohol use. And I don't know if many of you in the Caribbean may have heard many of our songs from Trinidad that are very explicit in the use of alcohol, and up to 70% of our population will support the banning of songs on radio that have a strong reference to alcohol. Labeling and retail sales. Will you support the national campaign looking at more prominent labeling? Many people are 90%. Prominent label in terms of alcohol concentration, almost 90% again. Will holding sellers of alcohol responsible for the amount of alcohol we sell to the patrons, a little bit less, just under 80%. Which of the following changes regarding alcohol in terms of drunk driving and public education? So as you know that we have the breathalyzer use in Trinidad, and that's been one of the successes of our interventions in Trinidad. And people up to 90% would support stricter and more intensive use of the breathalyzer and increased fines for drunk driving. People are very keen on public education campaigns, even though there's not a lot of very good evidence that these public education campaigns are very useful or have any lasting impact. I know we spend a lot of money on public education, but it seems to be that where we should really focus our attention is sensitizing our public to changes that we would like to make. But in terms of relying on education to make an impact, many of the studies suggest that only an impact will be made for a year. After that, the effect wears off. Many people are willing to support taxation, so this almost over 80–85% are prepared to support increased taxation on alcohol. So this, in summary then, is two of the bits of work I've been looking at. And how does this now guide us in our way forward? How should the civil society use this information in moving forward in terms of our work? Well, there are opportunities and gaps. For one, a comprehensive regional policy on alcohol. As you saw from that early slide, in the region, almost none of the countries have a national policy. And there's a role, I think, for bodies such as CARIPAPAN to look at working on a comprehensive regional policy. And Dr. Reed and I have recently presented at the Caucus of Health Ministers asking for that regional policy. And the health ministers are very supportive of the idea. The opportunities for advertising and marketing restrictions, and even though I suspect that we will be met with some resistance in this area, the fact is that almost throughout the region there's nothing happening except as we saw from Bahamas and Jamaica, and so the opportunities for us to work even with small components, for example, alcohol and adolescent marketing towards the adolescent. There's very little in the region on driving license suspension. I know we've had some discussions in Trinidad, but I'm not seeing anything on this in the region, and it might be that we want to look at this a little more closely. And then finally, zero tolerance to youth drinking and driving. Some documents have suggested that if you focus on the youth, practice zero tolerance to youth drinking and driving, you can make a difference. The opportunities for us to do case studies and sharing of best practices. When Dr. Jürgen Rehm, who presented our first webinar, was asked, should we approach this at a regional level, or should we approach this on an island-by-island basis? One of the things he said is that it's not an easy thing to answer, but one of the things that we could do is look at what's been done in some of the places and use the best practices there to inform practices in other islands. And I think that there is an opportunity here. How did the Bahamas arrive at this really very high level of alcohol restrictions and interventions and policies compared to the rest of the region? There's opportunities to follow up. We've had a few very good meetings in the region, the Belize PANAF meeting, and plus the Port of Spain Declaration on Chronic Non-Communicable Diseases. There, alcohol has been mentioned in that forum, the Port of Spain Declaration, and there are things that they've said in that forum that I think that organizations such as the Healthy Caribbean Coalition can bring back to the government's attention. There are things such as using the public revenue derived from alcohol for preventing chronic diseases. Has that happened? And this document is over 5 years old. So there are opportunities now for us to go back, review these documents, and twist our government's arms a little bit. Listen, you promised this. Why is it not happening? As in any discussion on alcohol, I think we need to always be cognizant of the historical failures of overzealousness and be conscious of the historical intertwining of our societies, Caribbean societies that is, with alcohol production, trade, and contribution to societal development. Many of our communities are built on cane farming and alcohol production. So I think we need to recognize this in any discussion on what sort of restrictions we're going to be putting on our population. In the short term, Caribbean civil society should work with, for example, one of the challenges we have is how do we get together as a group? This webinar is an excellent opportunity. But when we do have meetings, for example, with under PAHO, we should always try to pull our group together and ask for a half-day meeting for the region being the speaking Caribbean, because often, as you see, many of the challenges we face are shared by us all, and so there are always opportunities for us to get together and consolidate our own personal interests, which are often different from our Latin neighbors. Examine the gaps identified in the Port of Spain Declaration and see how we can move some of those things forward. Encourage strengthening and enforcement of existing regulations and laws. One of the things that I came across is drinking in our youth. For example, 25% of our young people under the age of 13 to 15 admit to drinking enough to get drunk. And yet still we have very clear legislation in the region about selling and exposing our young people to alcohol. How can we better enforce the rules and regulations and laws that already exist? I think this is something that we can encourage our government and our detective services, police services, and so on to work with. Establish working relationships with other NGOs, FDOs, and CBOs. Survey these organizations and even commission short public opinion polls to the feasibility of support in some of these priority areas. I don't think that we get a chance to do enough of that in the region. In the short to medium term, in recognition of CARICOM's stated acknowledgement of alcohol as a risk factor, we should establish lines of communications with CARICOM, CMOs, heads of government, ministers of health, and so on, and work on this regional alcohol policy. Establish lines of communication with members of government and explore feasibility for support of identified priority areas. In the medium to long term, we should work with governments and regional bodies to implement new regulations or laws and, of course, in time resume the process, looking ultimately to a framework convention on alcohol control. So my final thoughts. Regionally, there are clear gaps in the policy landscape around alcohol. The intertwining of culture, economic interests, and political lethargy and public acceptance makes change difficult but not impossible. UWI's recent national survey in Trinidad suggests that many households are amenable to change in this region. There are clear opportunities for CSOs, advocate for new policies, strengthen old ones, and prepare society for change. In concluding, I want to just leave you with this little thought. If you produce cars, it doesn't mean you need to drive fast and you still have speed limits. If, as in the Caribbean, you produce rum, I leave it up to you. Thank you very much.
Thank you, Rohan, for that comprehensive overview of where we stand as a region as it relates to alcohol policy, the challenges we are likely to face, and the recommendations for the way forward. I am sure that our participants must have a lot to share now in terms of their own experiences, thoughts, and of course questions. So at this time, I invite our participants to share comments and or questions, and you will do this by typing the questions or comments in the chat since we are in listen-only mode. So at this time, I invite you to type your questions and we will respond to these questions or share your thoughts and comments. As you type your questions, I would begin with a question for Dr. Maharaj. This is the question. I want to refer to what was shared about the Bahamas, and it is indeed quite impressive that the Bahamas is so far ahead of the rest of the Caribbean with regard to national alcohol policy. Rohan, do you have any information on what exists in terms of enforcement of this policy. Because we know that even though the other islands lag behind, there are policies in place which are not very consistently enforced. So the first question, do you have any information on enforcement in the Bahamas? And secondly, do you have any information on whether the prevalence of alcohol-related harm in the Bahamas is any less than the other Caribbean islands?
Yeah, excellent question, Sandra. And those are the same questions I've been asking our friends in cohort in the Bahamas. Unfortunately, well, the other issues also. One, has it made a difference? Has these laws, new regulations, made any difference at all? At this point, my answer to both of your questions are no. But I think that I have started the process of trying to identify how has this come about? What's the historical perspective in which these things were brought in, even quite an early time in the history of the region, and how has it been implemented? I know that when you look at the research, some of the early studies on adolescent drinking and adolescent issues have come out a little bit earlier than some of the other English-speaking Caribbean. So they seem to have had a recognition of some of the challenges at an earlier stage in historical development. And I'm not sure if that is what drove some of the process. But at this point, I can't say that we know very much to the answers to those questions. But it's something I will be working on, because I think there are things that we can share in the rest of the region. I think that would be very useful.
Okay, thank you, Dr. Maharaj, for that response, and it certainly points to the fact that we do have a lot of work to do. We have some questions and comments coming into the chat, and the first is from Nasha Modest from Trinidad and Tobago, and she says, very good presentation, Dr. Maharaj. A lot of the statistics were alarming. I thought households would have wanted more of a change. However, I can understand how the culture influences these mentalities. Any comments that you want to make, Dr. Maharaj?
Yeah, I mean, I had about 7 or 8 slides on culture, and Prof. Hassel very wisely recommended that we cut it back a little bit, and I'm glad that we did that. But there is a lot to be done about culture. I think that Professor Ream in her last presentation really set a great precedent for us when he says, Italy has this history of wine production going back to the Romans. And yet still they were able to significantly reduce their alcohol consumption and the harm from alcohol. And it's been demonstrable over the last 25, 30 years. And I think that we have to take some sort of good hope from this, because we like to say that, we're rum producing, we're rum drinking, we have a culture of carnival and acceptance of alcohol. And it will be hard to change. But if, as he was pointing us, if you have very good examples from around the world, such as the Italian, we can also have some, take that as an example for ourselves. So I think that it's something we shouldn't ignore. I think getting some of the best practices from around the world and showing our population, listen, other people have done it in recognition of the danger and the harm that alcohol does. We can do it too, and at least become more sensible about our consumption of alcohol.
Now we have a comment and question from Chris Brooks from London, England. And he says, interesting that age restriction increased to 21 is moderately acceptable. Is this a good protective factor for young people? Dr. Maharaj?
Well, I mean, if you look at the culture, out of the States, where they have the 21 years, I'm not sure if it makes too much of a difference. I don't know what the answer to that is. I suspect that we can talk about it. It might be difficult to enforce. It would require a huge change in culture of a lot of the region, where our young people have traditionally had access at age 18. And even that legislation that says 18, we're seeing our 13 and 15-year-olds saying 25% of them saying that they get drunk by the time that they're 15. So I am not so sure. I think the issue around enforcement and having a lot of the availability of alcohol to our young people is really a big issue. A lot of our servers are not checking on age. Once someone is drinking at the table, alcohol is shared quite freely. And I'm not so sure that increasing it to 21 will make too much of a difference, but there is some idea that people might support this. I don't know. I think a lot more work has to be done on
it. And from Dr. Edward Clark in Trinidad and Tobago, he says, most children are introduced to drinking by their parents. Should we not target parents and schools in educational programs about the serious long-term health risk?
Yeah, I think that it's something that I've thought about a lot. I think that there is such a level of acceptability by our parents and to alcohol drinking. We see it so much across the board. 2 years ago, we looked at a study that looked at how women who became addicts became introduced to alcohol, and almost universally, it was the idea of availability of alcohol in the home, making it acceptable. In another part of the same study, we talked to people about how do you talk about the dangers of alcohol, and only 53% of the household actually counsel their kids on the risk associated with drinking. And I think that is where we could put some effort. We may say, okay, it's probably inevitable that people are going to drink, or 60% of the households in Trinidad are drinking. Yes, okay, but are we spending the time to counsel our young people about the dangers of drinking chronically, the dangers of drinking and driving, for example? I'm not sure that people are doing that. And as we said in our research, only 53% of households who drink are saying this. So I think there definitely is a role for us in terms of raising awareness in the region. Yeah, absolutely.
Our next comment and question come from Glennis Andel Breton from Port of Spain, Trinidad. Excellent presentation. The risk factor surveys done in the region show very high levels of alcohol abuse, particularly among males. What are your thoughts on reducing access to alcohol by reducing the hours that bars can operate?
Yes, thanks, Glennis. Nice to hear from you. Absolutely. I think it's something that we should look at. But as you see in our first part, people are less inclined towards reduction of bars. There's an interesting story. 2 or 3 years ago, we had a COE where we had limitations on times of where people can go out. A state of emergency, SOE, sorry. We had a state of emergency in Trinidad. And one of the comments coming out is that people weren't happy because the bars would close and the alcoholics would come home. And if I'm not mistaken, there was even a hint that domestic violence went up during those periods because the alcoholics were usually in the bars and now at home. That's a frightening thought, that our people prefer the bars to be open because we don't want the alcoholic husbands to be at home. I would like to go there, Dennis, but I think that we need to explore this phenomena a lot more to understand the impact, the public health impact of such an intervention, given those sort of statements and the sort of concerns that people have. But I think traditionally we've had Thursdays and Sundays used to be times where you couldn't sell alcohol. If you go to Toronto, the licensed alcohol bureau in Ontario, Friday evenings, all alcohol sales are closed in grocery. Other countries are doing it. I think there's an opportunity for us to look at. Yes, I think so. Thank you.
We have another comment from Nasha Modest from Trinidad and Tobago, and her question is, how might we get these households to buy in? Rohan?
I think that there is a great role for civil society to work on sensitization. I mean, we started to see some of the ads. I don't know if any of you have been to the cinema in Trinidad. Some people have been providing support, financial support for very graphic ads in the cinema. There was one young man, they had a short vignette on a young man who became paralyzed, and he was saying, listen, I was drinking, I was driving, I had this. It was actually quite graphic. I felt very disturbed watching this thing. So there is a role for sensitization that we see some sensitization going on. I had another slide where where some of the alcohol advocates were saying for the issues around having a designated driver and so on. So there are opportunities. Whether or not we can really use civil society to really take that further, I think that we need to start the sensitization process, especially if we're going to think about getting a regional policy. If people are not ready for it, I think there'd be a lot of resistance. And we know that once there's resistance, a lot of people, the politicians will back down and change will not happen. So sometimes going in the big way sometimes is a big of a challenge, and maybe we should pick the low-hanging fruit, the things that we can work on very quickly to move our interventions forward. But sensitization, I think, is one of the big ones. And looking at opportunities, I mean, the story about Italy, maybe make that as part of the household discussions, and I think that might make a difference to our population.
Okay, and finally, this will be the last comment, and it's not anything that requires a response, but Maria Paz Corpoalan Barros from Chile is asking, will we have the PowerPoint presentation? And these presentations will all be put on the CARIPAPAN platform. If you are not yet a member of CARIPAPAN, you are invited to register, and you will have access not just to this presentation, but the one that was done a few weeks ago by Dr. Jürgen Wem. So at this time, I would like to wrap up on this morning's presentation. Dr. Maharaj, we would like to thank you for what has been a most interesting and informative session. Work like this is important in understanding how societies feel about alcohol use and alcohol control. But we also know that emotion and politics that you referred to in your presentation make the task a much more challenging one. What is clear, though, is as we move forward, the decisions that we take must not only take into consideration best practice, but the specific sociocultural norms of the region. And we have our work cut out for us. So once again, thank you, Rohan, and thank you, participants, for this interactive event. And at this time, I hand over to Sir Trevor.
So I'd like to thank Rohan, Dr. Maharaj, for his excellent and outstanding presentation, which has triggered much interest and discussion. In fact, it's interesting that the hour has gone so quickly. We have not even had an opportunity to share with the audience significant representation made to health ministers at a caucus in Washington, D.C., which has been well received by ministers of health. But I'm sure there will be an opportunity to share with this audience and others the outcome of that representation. I also want to wish special thanks to Dr. Reed Sandra for her chairmanship of the webinar. And of course, as usual, as I always say, these webinars would not be a success in the absence of an audience. And so I thank everyone for attending and taking part in the discussion. We at the HCC, we continue to be encouraged by the persons who registered to take part in the webinars. As has been mentioned by others, I invite all of you to continue the discussions and share information on alcohol policy using the electronic platform CARIPAPAN, which connects Caribbean civil society organizations and other related organizations working in the field of alcohol advocacy and prevention. The aim of CARIPAPAN is to facilitate mutual learning and strengthen individual and collective evidence-informed alcohol policy and action. Our next webinar will be held on a date that we will share shortly, and on that occasion our featured presenter will be Dr. Maria Stella Monteiro, who will speak on the topic Conflicts of Interest Related to Alcohol Policy. What can be done? This is a very important topic. Dr. Monteiro is Senior Advisor Alcohol and Substance Abuse at PAHO, and she has in fact taken a leading role in the development of alcohol policy throughout Latin America and the Caribbean for many years. And so I look forward to all of you being present at the next webinar as we continue to seek to create an environment in the region that will facilitate policies and legislations appropriate for the region. To keep updated with activities of the HCC, I encourage you to follow us on Twitter at Health Caribbean or visit healthycaribbean.org. And so finally, once again, let me say thanks to all, including Maisha, Executive Director, for the overall arrangements, and to Ian Pitts, our IT Manager, for technical arrangements. Thanks very much, everyone, and goodbye.